Hi, my name is Dr. Caroline Guerrero-Cauqui, and I am the chair of the Fellowship Committee for the International Academy of Orthokeratology and Myopia Control. In this video, I would like to give you some tips on how to prepare your cases for the mentor-led exam and oral panel exams. Now, in order to sit for the mentor-led exam, you will have had to pass the written test with a score of 85% or higher. Now, we may allow exceptions in rare cases, but generally we require that you pass this test already. You will be assigned a mentor, and the mentor's role is to guide you in preparing your cases and help you prepare for the mentor-led exam. They're going to give you tips on the protocol, on case selection, how do you select the complex cases that are interesting for the panel, and then how to prepare these cases. They'll answer questions, and also they will conduct the mentor-led exam. Now, the cases that you provide your mentor and the oral panel exam have to be interesting and complex because you are demonstrating your fellowship quality fitting skills. We cannot schedule an exam unless the cases do appear to be complex or interesting. And if they are not, we'll be asking you to find new cases that support this particular idea. Now, here are some of the categories that might qualify, but of course, if you have a case that doesn't fit into these categories and is interesting in your opinion, then go ahead and submit it. That's fine. Or talk to your mentor and see if that's something that might be appropriate. So, for example, we'd be looking at something like maybe poor myopia control, which of course you wouldn't know for many, many months, but then you discover it is poorly controlled, and then you make the designs. But then of course your particular case will have to go over the period of at least a year to show that you have better control of the myopia. Or maybe you've taken on a post-surgical case that you fit with Ortho-K and created very, very nice vision. That would be interesting. Perhaps a very high toric lens that you've designed that maybe has limbal to limbal, or very high sill, but not just a standard limbal to limbal, something that's just really creative and interesting. Perhaps you have a case that is decentered, and not just a typical decentration where you fix it in one shot, but you fix it, you do everything that you think is very by the book, and it doesn't work, so you have to do something else and something else. That would be interesting because you will then be able to discuss the things you did and why they didn't work. Perhaps you have a severe over or under correction that isn't just real obvious. It takes some skill to correct it. You may have a problem with lens adherence, and of course everybody has a little bit of a problem with that lens adherence now and then, but this is something that would take definite improvement to and technical skills and troubleshooting to improve. Perhaps you're refitting from another practitioner who has really bungled the case, and you take it over, rehab the cornea, and then create a very good quality vision for the patient. You may have a case of very, very high myopia that you have created to give incredible vision, and this is a case that's not typical, not just your basic, -7. I mean, this has got to be something very interesting and difficult, challenging. Or perhaps you took on a case and it just never worked. Despite some very serious, very thoughtful and clever troubleshooting, it never worked. You don't have to have a case that works in order to submit it, so long as you are able to discuss what you've done, how it didn't work, how you've made some other changes and they didn't work, and then thoughtfully discuss why that is the case. So in other words, you just have to select cases that show us that you are an advanced orthokeratologist. Now, we have provided you a case template for use in standardization because we want to be able to look at this case and not get confused. We have created a template in a PowerPoint design because each slide in a PowerPoint design is encapsulated, and so what you put in that slide stays there. Unlike a Word document where you might put in a topographic map and it flies into some other page. These stay in place, and that's why we have chosen the PowerPoint instead of a Word file. We've also designed it so that you remember to put in all the data that we require. There are little areas where you can slip in a topography or slip in a sodium fluorescein video, and they're reminders, but they also will keep your data in place. And our templates have been customized depending on the type of fitting method you choose. So you prepare your cases using the template. Remember, if any data are missing, you've got to tell us why. Document the reason. More is better. If you're missing some particular map or you're missing a particular visit, explain why, because otherwise we're going to assume that you are just a poor quality doctor and you are not using all the data that you're supposed to, or taking maps, or you're not doing the proper follow-up. So make sure you tell us if something's missing and you know that's wrong. Tell us why. We won't grade you off if it's missing unless you're missing a whole ton of things, but if you don't, we may question, and it's not good to have someone ask you a question, why is that missing? Because you didn't tell us in advance. Also make sure that the data makes sense to you, because, for example, let's say you put down, oh, the patient's uncorrected acuity is 20/20 and their refraction is -150. That doesn't make sense. So go through and make sure this all makes logical sense. Make sure you demonstrate your skill and your knowledge. Now, on the pretreatment data, here is a list of the different things that we're going to request, and that is on the template, so you'll be able to just drop in there and enter the data. And then we're going to, of course, ask for topography, and it's up to you to choose the maps that you want to present in the pretreatment. And make sure that you have thoughtfully selected these maps and that you haven't left out anything that might provide us with very good information, because we're going to ask you about it, and if you can't say, oh, well, I didn't think that was necessary and we think it was necessary, that's going to be a problem. Describe the maps and what they tell you, and assess them as to how that's going to affect the fit and how it will affect your design. You'll also have an area for the summary where you get to discuss the concerns about this case, why you think it's interesting or complex, and then assess the patient's candidacy. Is there any pathology that you're going to have to deal with? What is it about this refractive situation that might be very interesting or complex? And why did you take on this case? And then, of course, what's your plan? How do you plan to attack this case and provide the patient with the finest outcome possible? Now, as you can see right here, we're showing you 3 slides of the different slides on a PowerPoint template. As you can see, there are areas for the pretreatment data, for the topographic maps, and also the assessment and the case assessment. There's also areas for sodium fluorescein later on, but not in the initial pretreatment, because you're not going to have any sodium fluorescein pictures at this point. Now we come to the portion where you are going to describe your fitting. And you may use trial lens, empirical fitting, or you may do a custom design. And the template allows for each of these 3 different ones in different sections. And so first, if you're doing trial lens or empirical, you're going to tell us, how did you select your first lens? And then you're going to put the lens on the eye, show us videos or photos, describe what you see, assess the fit. And then if you don't think this is appropriate, and probably it won't be appropriate, or if it is, we're going to want to see other lenses as well, because it would be crazy to just show us one lens and say this is the one I'm going to use, and then go on to show us the second and the third lens. Now, if it's a custom lens, of course, you're going to custom design it and tell us how you chose those particular parameters, and then after that lens is made, you'll put it on the eye and describe the fitting characteristics of that particular lens. And you can see here are the templates for diagnostic fittings for, this would be a trial lens. And then this page is for fully modifiable. And what we really want from a fully modifiable is that you enter the lens parameters or give a screenshot so that we can see exactly what the curves were that you selected. Remember, when you are showing patient information, make sure you remove all the patient identifiers. Just use ID numbers, but don't use the patient's name. Now, when you get to the follow-up, you want to provide the data for each follow-up visit. And a typical follow-up is 1 day, 1 week, 1 month, 3 months. Remember, if any of the visits are missing, explain why. So in presenting those, identify the visit, because you have no idea how confusing it is for one of the case reviewers to look at the case, and when we get down to maybe the second or third lens change, we don't even know what day it is anymore. We're so confused, and it's kind of hard to go back and forth in the different slides. And so if you label this day 1 with the date and the lens number, it's so much easier. Or 1 month with lens number 3, this is the date. If we have to go back and forth and try and figure out where we are, you're going to find that the reviewer just they won't do it, and they'll reject the case. It's got to be orderly and easy for us to follow. And you're going to enter the parameters and the lens number, and then of course all of the information here. Usual wearing time means how many hours a night do they sleep, and then wearing time today means how many hours did they sleep with it that night, the night before you saw them. That's always useful information. And then what are the acuities with and without the lenses? And then on the first visits, of course, you're going to want to show us some videos of fluorescein if that's at all possible. If you select a case that you did a year or two ago and you don't have video for it, but you think it's a fabulous case, okay, but we really need fluorescein to really give you the best analysis and presentation. Of course, the topographic maps are also super important, and what you want to do is make sure that you select the appropriate maps for demonstrating change and defend why you've chosen them, and then discuss what you're looking at. What do these data mean? How is the treatment progressing? And then you can see right here we have the nice little slides from the PowerPoint where you're going to drop in your data and your analysis. And there's 4 of them here. You can look at them very carefully. They're looking for the design parameters, and then you can put your maps there right in the little squares, your analysis. You'll type that in. Now we get to troubleshooting. What you want to do is describe the problem and then be very specific about how you're going to fix it. You're going to show the parameters of the new lens and then also the old lens, so we can go back and forth and look to see what is it that they changed. And if you don't do that, we have to zip back up to the old lens, and that's a little bit confusing because we have to go, okay, let's see, the diameter was this on the old lens, here on the new lens. Put them together so we can really see. Remember, in the proprietary designs, you're not going to know what the actual curves and diameters are necessarily. Maybe the overall diameter, but not the diameter of each of the individual curvatures. And that is, it's a problem for us, but what we've done is just said, what you're going to do is say, what would it be? What are the changes you would make if you were making the changes? You're going to tell us what lens you're ordering and how you ordered it and how you came upon that idea. But if you were the proprietor of this lens, the manufacturer of this lens, what is it that you would have changed to change this fit on the lens? To say that you called up the manufacturer, told them the problem, and they told you what to do, that's probably not a really good thing to tell us, because that doesn't show fellowship quality. But if you actually called up the manufacturer and ordered a different lens based on your experience, but said why you chose that particular lens and what you anticipated was different about the lens you chose compared to your other lens in terms of how it fits, that's what we're looking for. And of course, use the template to supply the data that we need to assess the fit and the outcome of this. And then when you get to the final visit, what you sit here and you say, okay, in retrospect, did you handle all the original challenges that you told us you had? And what sort of lens changes did you make, and how did it affect the outcome? Sort of just give us a nice recap. Could you have done more? If it wasn't perfect, why didn't you continue? And that's not a problem if you want to stop and the vision wasn't 20/20. Just discuss why you chose to stop and how the patient felt about it. What might you have done differently, and what did you learn from the case? So there you have it. You have a good fit, good vision, happy patient, you're done, the case is done. The takeaway from this video is that you've got to choose a good case, an interesting case. You've got to provide us data that makes sense and is presented in an orderly fashion so that we can follow your thinking, try to explain everything you've done in advance so we don't have tons and tons of questions, and make it nice and clean. Happy preparing. And